So our first set of presentations, we've called it From Singing to Sepsis to Spinal Balls. So 3 S's, but they're all about colleagues, clinical colleagues who have taken action at the front line. And we have 3 presenters, Dr. Jeremy Tong, Dr. Damian Roland, and Rebecca Buswell. So the first person I'm going to call on is Jeremy Tong. And Jeremy is going to talk about the impact of his pledge, which was a really important topic, improving the early recognition and management of sepsis in children, and doing this through widespread education and the implementation of a simplified care bundle called the Pediatric Sepsis 6. And Jeremy, you've got 8 minutes to tell us about the Pediatric Sepsis 6. So good morning, Jeremy.
Morning, Helen. How are you?
Very well. Yeah, I can hear you really well. So
excellent. Yeah. Hi, everyone. I'm Jeremy Tong. I'm one of the senior trainees at Birmingham Children's Hospital. I'm masquerading as Kathy Osborne on the panel at the moment because I've hijacked her laptop, but hopefully this will work very smoothly. My Twitter handle is @jez_tong. I'm going to talk to you today about the Pediatric Sepsis 6, and of course my pledge for Change Day. So the story started with my experiences of looking after children with sepsis. And so as part of my role in pediatric intensive care, I quite often see children with very severe infections who have multiple organ damage and failure. It just struck me when reading through the news, and this tragic story of Sam Morris is just the latest of them. There's been others in the past, and I think if you look back through the media, you will see there are lots of stories out there of children with severe infection who may have survived if they had different care. So, in fact, it got to a stage where the healthcare ombudsman was commissioned a report on sepsis, which was published on just before World Sepsis Day last year. It's called Time to Act, and in it, it describes a number of failings that the NHS has with people with sepsis. One of the cases is children, but if you look back at other reviews of child mortality, you will also find sepsis as a theme. And the reasons for, or some of the significant avoidable reasons for these critical incidents is a failure to recognize severe illness and severe sepsis in children. And you know what, to be fair, it is very difficult to recognize sepsis and differentiate that from other types of self-limiting or less severe illnesses. It is difficult. There are consensus guidelines out there that all pediatricians know, but the trouble is, I think because sepsis is a relatively rare thing, it's the incidence is about 0.9 per 100,000 children per year. People don't see it that often, and therefore, when you're in a sea of cases where the symptoms and signs are very similar, how do you pick out that one child that's going to be really sick? So I work with, had the privilege to work with the CEO of the UK Sepsis Trust, Roland. together we put together a group, and we worked on a pediatric version of the very successful adult sepsis 6 tool and initiative. I felt that after having worked with Roland for a little while, I felt that the adult sepsis 6 was right on so many levels. They were connecting with people at the front line. It was empowering the very people that were going to recognise the signs and symptoms in patients and give them a means to escalate the treatment at the right time. So I felt there was lots of things that we learned from that. And so we put together a pediatric group, working group, to design a tool for aiding in the recognition and management of sepsis in children. So this is the tool. We came up with the pediatric sepsis 6. So the pediatric sepsis 6 we promoted via social media, via posters at professional conferences, and word of mouth. And we're now able to reach a number of trusts, and it's been agreed to roll it out across the whole of Scotland after it was piloted in Dundee. It's also been rolled out across my trust, and we're now using the tool within the ICU where I work and within the ED department, and the other departments are following very shortly. So to raise awareness, actually, it's different. It's about connecting with people at front. I think the people that are going to recognise sepsis are the people that are looking after children. So that will be the bedside nurses, that will be the people in triage, and sort of the most junior staff, junior doctors who will be picking up the signs or who will be called to review it, children who are just not quite right. And they're the ones that we wanted to target. So we devised an education program where we taught at the bedside, 3 or 4 nurses at the time, with a set of very simple slides, 5 or 6 slides, and we went around every morning for 2 weeks, and we did this power teaching, and we managed to reach about 70% of our staff, which is over 300, within the 2-week time period. We're now way over that. And we also devised other ways to engage. For example, you can see Yvonne here is wearing a sepsis 6 card around her neck on her lanyard, and that just helps remind people about the sepsis criteria, and we found that really useful. It becomes a talking point because it's nice and bright, and people wonder where the card's from. So then we're raising awareness through a number of channels. You can also see Yvonne is holding a box called a sepsis box, and inside is all the tools you need to manage a child with severe sepsis, alongside with our crash trolley. So in it you'll find the antibiotics and things. Again, it's a way to raise awareness. People know the box is there, and people thinking about it a lot more often. The design of the tool itself is also designed to allow people to help people make the right choice. So rather than missing sepsis because people aren't thinking about it, it's saying, okay, your child is unwell, and they could have sepsis. Can you just think about it a bit? Just go back and have a look and make sure that you don't miss it. And that is the key thing, I think, in this initiative that will make a difference, which is earlier recognition and earlier treatment, because the data that we have out there is that the earlier you treat, the better the outcome is going to be.
Oh,
so
yeah, I think we've run out. So, yeah, go on. We've just got run out of time, Jeremy. Go on. So.
All right. Okay. Sorry. Yeah. So just quickly. So since I've made the pledge, which was to raise awareness and recognition of sepsis, we've been out and I've talked about sepsis to anaesthetists, pediatricians, senior pediatric trainees, junior pediatric trainees, and I'm going out to Wolverhampton next week to do another talk. So that was my pledge, and thank you very much for listening.
Oh, Jeremy, that was really fantastic, and I just think, you're the first case study that we presented today, and what a fantastic case study to start with. Change day pledges and saving children's lives. That's really wonderful. So what we're going to do is we're going to hear the next two presentations, and then we'll have an opportunity to ask Jeremy some questions shortly. So stay with us, Jeremy. One last thing: where are you today, geographically?
I'm in NHS
in Coventry.
In Coventry, yeah.
Fantastic. Great. So what I want to do is kind of get a sense today as well of where people are around the country. So so stay with us, and let's move on now to our second presentation, which comes from Dr. Damian Roland. And Damian pledged to lie on a spinal board in the middle of a massive national conference in a collar and block for 1 hour. That he did this on Change Day. So Damian, can you hear me?
Hello, can you hear me?
Yeah, I can hear you, but I can't see you.
Fine. I might have a bit of difficulty with the video because it might crash my.
Okay, don't worry. We can hear you, and that's the most important thing.
Cool. Well, we'll see how it goes.
Yeah.
Do I have control?
I can see you now. I can see you.
Yeah. Cool.
Right. Yay.
Do I have control to move the slides along myself?
Yeah, no, I'll be doing it from here for you, so just give me an indication and I'll move the slide on for you.
Brilliant. So thank you very much, Helen. Good morning, everyone. I'm sitting in my office at Leicester Royal Infirmary in Leicester, which is where I work. This is my second Change Day pledge, and I like doing experiential pledges. So we're going to hear loads of pledges today of very different motivations, very different kinds. I quite like the one where you get a bit stuck into patient experience. So last year I tasted some children's medication, and this year I lay on a spinal board. Why did I do that? Well, if we move on to the first slide, children very rarely get injured by really serious trauma, but it does happen. Thank you very much to Hartley Hall's blog, because unfortunately they had a children's party there where a little young girl sustained a back injury after a fall, and an ambulance was called out. And as you can see, the poor little girl had to be put on a spinal board and her neck placed in a collar to make sure that she didn't sustain any further injury if she had broken her back or neck. We move on to the next slide. But you can see from the close-up that it's not the most comfortable of positions. You've got these two big rubber things next to your ears, your neck is locked in place, and you're on a very uncomfortable board. And most importantly, you've got a lot of people kind of around you. And the key thing is that this is just happening at the place where the incident took place, but the child needs to be transported to hospital. So if we move on, you can see that not only do you have to be moved from the house into the ambulance, you've got the ambulance journey, and then you've got the actual, depending on how long the journey is, potentially 10, 15, half an hour, maybe more, to actually get to the hospital. And even when you get to the hospital, you may be waiting quite a significant period of time if x-rays need to be done, etc. And I just wanted to know how that felt. So if we move on, the key thing for me was whether It was an experience that was painful. Wasn't an experience that was frightening. Was this something that we needed to individually change our practice for, or collectively change our practice? Let's move on to the next slide. Well, there should be a picture next.
Paul, can you move on to the next one? So there's pictures there.
Hi, Damian. Sorry, we just have a little technical glitch with the slide, so we'll
okay.
see if we can get there. Right.
Keep talking, Damian.
So what was you might probably need to go back one or two, but anyway. So what happened was that I did a trial run because I wanted to know actually if I was going to lie for an hour on one of these boards in the main conference room. With lots of people looking at me, I needed to be sure that I might be able to get through the experience. And that trial run was really interesting. And the reason I'm telling you about the trial run is because of some of the great stuff that I've learned from Change Day itself, which is about engaging others and a bit about the importance of narrative. And the great thing about the trial run is it got people interested in my pledge even before the pledge really happened. So that the fact that I was just spending this time on a board in the department, we had a photographer come around to take some pictures, it got people talking. And it was that very visual nature of what I was doing, got people talking in the department about being on spinal boards. Was it painful? What was Damian doing? What is Change Day? And I think that's a really important message to get out, actually, about the way that you can get people discussing things without actually having to directly go and speak to them. It was just about the visual event that took place in the department. Can we go back a slide? Okay, I think obviously there's a few missing. Anyway, so what happened on the day itself? Well, I pitched up. A huge thanks to Kirsty Challen, who is an emergency department registrar in Manchester, for providing the board and the blocks. The event took place at some point in the morning. I was lying down, and I noticed one thing immediately, which is why I'm showing the slide in front of you. You get a very different perspective of the world, and it is a very unsettling perspective. I'm 37 years old, and I found it a bit, oh, this is a bit weird. Lots of people looking directly down at me from an angle I've never seen before. But actually, imagine if you're a 7, 8-year-old boy or girl experiencing that, it's going to be scary. Can we move on to the next slide? So that's what happened originally. I then spent a bit of time getting settled in, 10 or 20 minutes. Actually, that was quite good fun. Lots of people kind of coming up to chat, was quite engaging, still a bit unnerving seeing people looking down at me. But then the next thing happened is that someone decided to move the board around the room a bit. And it's amazing instantly, because the ceiling moves and you're not, you get this seasick sensation. And I started feeling sick. Now, I didn't get uncomfortable, but as time moved on, I felt more and more nauseous. And when I came off the board at the end of the hour, I wasn't hugely sore, but I was a bit disorientated. I couldn't stand up properly because I've been lying down for an hour. My blood pressure was all over the place, but I just felt really sick. And I spent 5 minutes kind of trying to compose myself afterwards. So the really kind of the massive learning point for me was for children in this situation are going to feel potentially a little awkward, a little unsettled. And the story that I can now tell to the rest of the department is that if you've got a child on a spinal board, please do work very hard. 1, reassure them. When you lean over towards them, if you lean right over them, that's going to be quite scary. So position yourself in a way that actually is not so frightening. 2, they might feel not uncomfortable in pain, but uncomfortable either because they feel a bit sick or because it's a bit awkward. So 2, it's important that we reassure children about that. But most of all, just try and get them off the board as safely as is possible to do so. And I think the department has learned through some of my experiences. I see it now. As soon as a child comes in, we've got a lot of people around the bed kind of leaning them to get them off the board. Because actually, you can come off the board whether you've got the fracture or not, because as long as you're lying flat, that's okay. So actually, it's a part of a process of getting the staff engaged to do as much as they possibly can for benefiting this child. And my change day pledge not also kind of demonstrated to me that, but through the visual narrative of my change day experience, lots of others can share in that as well. So if we just move to the last slide, I think the change day process for me has taught me individually a lot, but actually I think the process of telling stories in this patient experience type way is a really good methodology of getting others engaged in a way that isn't particularly threatening. I'd like to thank again Kirsty Cullen for providing the board. I'm extremely grateful for her for doing that, and I'm really looking forward to questions at the end of this session. So thank you very much.
Damian, thank you so much. And again, you know, something as simple as, you know, being on a board for an hour, and yet such a powerful and I think symbolic experience. So thank you so much for that. And it's great, by the way, just for everybody taking part, that, you know, many of you are writing in the chat box. That's lovely. You know, let's hear about what you did. Let's get your questions and comments. So finally, in this session, we are going to hear from Rebecca Buswell. And Rebecca is a project support manager at Samwell and West Birmingham Hospital's NHS Trust. And she's going to tell us about her lovely pledge to start a small singing group to perform on the wards in her organisation. So welcome, Rebecca, and the virtual floor is yours.
Helen, thanks very much. Can you hear me?
Yeah, I hear you loud and clear. Can we see you at all?
Hopefully. I can't see any video at the moment.
Yeah. Don't worry, we can hear you. So that's the most important thing. So yeah, go for it.
Great stuff. Thank you. So yeah, as Helen mentioned, my pledge was to start up a small singing group that would be able to go onto the wards at City and Sandwell hospitals, hopefully then expanding over to Rowley, which is one of our sort of smaller community hospitals. The main reason behind the pledge was not just that I'm a keen singer and wanted to sort of perform in as many places as possible, but it was really to link in with our patient experience team as well. They had already started a fantastic programme of going onto the wards, taking Birmingham Royal Ballet dancers on there, and I went along for that about a year ago just to kind of see what was going on. And actually that was, I'd realised the first time I'd actually been on a ward in the hospital. Because I'm based in a non-clinical department, I do sometimes feel very far away from patients, and actually sort of walking onto the ward and washing my hands and rolling my sleeves up, I just thought, how on earth is this the first time I'd been on a ward? And really started to imagine what it's like for a patient, really. I've had family who've been in hospital, and it's obviously when it's your family, you're very close to them, and actually realising that everybody that's in hospital is somebody's family. So thinking about people who've been there for a day, 2 days, maybe even longer, and what their experience is sort of lying in a hospital bed, or even if they're able to sit up, and potentially if they don't have any visitors, you know, anything, if they don't have any stimulation throughout the day, what they'd be doing and what would make them happy, and anything that might be able to sort of enhance their experience at all. So as you can see here, I pinched a quote from Professor Graham Welsh, who has written extensively, and there's some information on heart research.org.uk, but I thought it was a fantastic quote in terms of really trying to sum up the benefits of singing. I think people might have seen the programme with Gareth Malone about the choir, and him sort of setting up choirs across various different organisations, and anybody that's involved in singing potentially knows the huge benefits it can have, not just for your body, but the psychological benefits as well, increasing confidence and self-esteem. It can reduce stress. It helps in terms of sort of boosting your endorphins and releasing all sort of the positive, happy hormones. And it has actually proven in a study I think I saw in about 1998 in a nursing home that it was, they ran a singing program there for people in the nursing home for a month. And after a month, it was proven to have actually reduced significantly the levels of depression and anxiety. So I've also got a background in psychotherapy, so I think potentially that has influenced my pledge as well. So if we move on to the next slide, big thing, patient-centred care. So sitting in the office that I work in strategic planning, we're at the moment really focused, as we always should be, on how we sort of link our high-level strategic plans to patients. And actually, well, the only way that I could think to get straight in and actually meeting patients and talking to them was singing, funnily enough. So I think really that was what motivated me to get there. Huge benefits for people's well-being, and as I've said, breaking up their very long days. And I didn't just want it to be about walking into the wards and singing and also performing and making it very one way. I really wanted patients to feel that they could join in if possible, and just spend a bit of time afterwards actually talking to them, and just having a chat and just seeing, you know, potentially whether they've done any singing in their past, if there are any songs they'd like to sing next time if we were able to go back. So yeah, so if I actually move on to what we've done so far, I think that's on the next slide. Yeah. So we've had 3 successful sessions at City Hospital, which is one of our main hospital sites. Myself and a colleague, Jo Ward, who's actually an NHS management trainee, who's just left us, unfortunately, but her and I basically began by going on to our medically fit for discharge ward, which is a ward for patients who are ready to be discharged, as it says, but are just looking probably for a placement potentially in a nursing home or somewhere similar. And a lot of the patients actually on this ward at the time we visited had dementia, so some of them weren't actually able to come and join us. We got the day room booked, which was fantastic, and the matron was wonderful, and they put on tea and biscuits for everybody. And some patients came down and sang with us. We sang songs like We'll Meet Again, we did some ABBA, we did some Beatles, we did just some of the old classics, and asked them to join in where possible. And it was just really quite poignant, and some of the staff were there as well, and our chief nurse came along, and some of the families were there as well. And it just created a kind of a joined up sense of, we're just, you know, at the end of the day, we all may be patients one day, and actually if we can just come together and have a bit of a sing-song and maybe make this day a little less challenging or difficult for people. And the feedback was really positive, and I absolutely loved it. Jo really enjoyed it as well. So we've been to another couple of wards, and we'll be heading to hopefully the rehabilitation ward at Buswell, the rehabilitation stroke ward at Buswell Hospital, hopefully in the next few weeks. Again, with patients who've potentially been in hospital for months, going through their rehabilitation following a stroke. So that's going to be particularly interesting, and I'm really looking forward to that. And I think we're just hoping to continue, really. We've got support from our dementia activity coordinators, who've been brilliant, and they've been bringing along boxes of percussion instruments so that patients potentially who are unable to join in with the singing can join in from their bed and either, you know, shake a tambourine or get involved. And yeah, there's been lots of big smiles, which has been brilliant. So the next slide. Sorry, I realise I talk very quickly. Establishing the choir. So really, it was Jo and I that did those first few sessions, and as much as, you know, we really enjoyed it, we would love it to not just be the two of us, and especially as Jo's left, I'm really hoping to establish a small choir of about 10 to 15 singers initially, who will actually set up a programme of monthly activity so that it's a regular thing, so that people start to know that there's a bit of a presence in the hospital, and we can come along and do some singing, do some interactive stuff. So there's an advert going out in our staff newsletter that goes out to all of our staff, and that's going out in July, later this month, and we'll have some first rehearsals in August. So yeah, it's very exciting. It's, yeah, as I said in the last point, it's not about performing and leaving, but it's about spending time with our patients. So if we go on to the last one. Yeah, where next, really? And there's a fantastic charity, I don't know if anybody's already heard of it, called Kissing It Better. And they'd already done some work with our hospital, with our trust, and I know they work across the country. But yeah, hoping to link up with them, really, and just try and see how we can kind of get this programme up and running and get a bit of publicity for it. I sing with a local choir called Ex Cathedra. They have a really well-established programme called Singing Medicine, they do a lot of activity at Birmingham Children's Hospital. So I'm hoping to link in with them and just see whether we can get any shared learning, shared tips to take it across our trust, and just get a programme up and running for the next 6 months. And potentially, if there's a way of measuring it without it being too target driven, just finding out, maybe after 6 months, has singing improved patients' experience of being in our trust, and certainly involving families and staff as well, because it's, I think, at the end of a long day for everybody, the staff are getting involved too. So I think, we can find a way to measure just whether it's kind of having a bit of an effect. That would be brilliant. So I think that's it from me.
Oh, Rebecca, thank you so much. I think what a lovely story, and how powerful. And I think you're a really great role model for lots of us, in the sense that you don't have a direct clinical role, but like your passion for patients and the organisation that you work for, absolutely shines through. And I think that's one of the great things about Change Day, is that it enables all of us, whether we're clinical or we're a non-clinical member of staff, whether we're a patient representative, whether we're part of a broader community, all of us can do things to make a difference that are really powerful.
Absolutely.
So thank you. So stay on the line now, and hopefully Jeremy and Damian are with us as well. And we'd love to have some questions or comments from other people. It's lovely that so many of you are joining us today, and welcome everybody. I'll just put me on, so I'll do a visible welcome as well. We'd love to hear any questions or comments. So please raise your virtual hand, or if you're shy, put your question in the chat box, and we'll ask it for you. Great. So we've got our first question from Helen Sanderson. Welcome, Helen. It's fantastic having you on our WebEx today. So Helen, you're unmuted, and the floor's yours.
I'm really intrigued about the way that Damian approached Change Day, and doing something that's experimental that then made a bigger difference to lots of people. And I just wondered whether you had other ideas about how you can take that forward.
Thank you, Helen. Do you mean actually just not in terms of the actual pledge lying on the board, but the way of kind of engaging others through experience like pledges?
It was the actual pledge, really, because that sounded so powerful for you. Is it something that you'd like to see as part of training for doctors or nurses? Would you like to see that going further, or do you think you've taken it as far as you want to?
No, and I think I don't think I'll ever be able to take this as far as I want to, because actually every new kind of healthcare professional coming through the system will have something to learn, and I think memories kind of fade quite quickly. And one of the important things that Change Day needs to do is to continue itself and continue having events and pledges, because otherwise the story gets lost. And that's why I quite like the kind of the visual and the video recordings. Despite that, I often get accused of a great deal of self-publicity. Part of it is the motivation to get others talking about it. I really like your idea of kind of other people doing that as well. And I hadn't actually thought of that. But there are a lot of things that medical students do now. There is a real drive. I think every medical student in the country actually experience what it's like to be frail and elderly. There's now special kind of suits or other things that you can do to experience what it's like to be visually impaired, or have difficulty using your hands, or have difficulty mobilizing. And that's something that I think everyone goes through. I'm sure nurses do similar things. If I am teaching about kind of trauma, I will always include something about what it feels like. And actually, a lot of this experience, you don't need the board. You just need to lie on the floor for a period of time. And anyone can do that. You don't need the equipment to do it. It's quite easy to do.
That's fantastic. I want to just see if anybody, just because we've only got a couple more minutes.
Sorry,
I think it's just so brilliant and so inspiring for this conversation. I just want to see if anybody's got a question or a comment they would like to ask Rebecca or Jeremy. I'll ask one to Jeremy then. So Jeremy, my question to you is, you know, you've you're talking about your approach to sepsis with other organisations. What, in terms of what you did, what is the kind of essence that other organisations or other clinical teams can take from your sepsis project and make their own?
Yeah, that's a good question. I think I think the main thing is the approach. The approach is different way. I think in a lot of care pathways or protocols are written by senior people, and that's not necessarily the wrong thing to do. But I think it's written by senior people, and then it's often filtered down through the levels. And I think sometimes the story is lost a bit by the time you get to the bedside person. So the bedside person finds it difficult to relate what the purpose of the protocol or the sheet of paper in front of them is for. And I think our approach was to turn that around and start from the people at bedside first, and then work our way upwards. Obviously, with the robust tool that was designed at the start from our group, and I think that's the approach that I would recommend other people take on. And I think there's other projects that are following on from our sepsis project that is starting to we're finding the benefits of getting it through a lot better by that approach.
Thank you, Jeremy. That's fantastic. And I'm going to ask the final question in this session, and this goes to Rebecca. And Rebecca, my question to you is: have you identified or joined up with other choirs from other organisations? And on the basis that if you don't ask, you don't get, would you be interested for Change Day 2015 in getting some other hospital choirs or other health and care organisation or other charity choirs involved in Change Day?
Absolutely, definitely. That sounds brilliant. For next year, I would love to. I think at the moment it's feeling very small within our trust, and I'm really keen to get it off the ground. But I think absolutely. I need to link up with I think at a Health Education West Midlands event last week, our chief exec said that he'd heard a fantastic performance from the choir from one of the local trusts. So I'll just be doing a bit of networking, hopefully linking up with our patient experience team, and just potentially going to visit some people from local trusts as well, because I think that's something I don't get to do enough. And I think linking in with the talent around the West Midlands and maybe broader as well across the country throughout the year would be great, just to see how they run things and to see how they potentially do different types of activities with different patients. Just thinking the difference between working with children and adults, and with patients with dementia and patients that have had a stroke. So I think it could be quite a rich project. So I will be keen to network.
That's great. And we'll be in touch with you as well, Rebecca, in terms of getting organised for 2015. So that's the end of that session. And then what I really wanted to thank Jeremy and Damian and Rebecca. You've got us off to a fantastic start. And one thing I wanted to encourage us all to do is, if you look on the panel, next to where your hand is, where you put up your virtual hand, well, next to it, there's a feedback button. And if you click on that, it gives you a menu. And what would be nice is if we could all give Jeremy and Damian and Rebecca some virtual applause. So will you press the applause button? Thanks to all three of you, and we look forward to what all three of you will do for Change Day 2015.